Assalamu alaikum everyone. I'm Dr. Ambreen and I'm assistant professor at University of South Asia. I'm delightful to be here on the platform of University of South Asia where I'm the course instructor of the subject Pharmacology and Therapeutics 1 for the students of Doctor of Nutrition and Doctor of Physical Therapy Semester 5. So let's begin this lecture by the topic that is hypolipidemic drugs, and this is the topic from the drugs used in cardiovascular system. And this topic we are going to discuss about what are hyperlipidemias and how we are going to reduce the level of cholesterol or triglyceride in the blood by the use of different hypolipidemic drugs. So moving towards the learning objective of today's lecture, let me tell you that after the end of this session, you would be able to have a better understanding that what is hyperlipidemia. You would be able to understand what are the drugs that can be possibly reduce hyperlipidemic condition, along with the mechanism of action, along with the possible adverse effects and thus useful effects of hypolipidemic drugs. Let's start from the previous lecture. Previously, we have studied about hypertension and arrhythmias, and we have discussed that what is the normal physiology of the blood pressure. That if our blood pressure is between 120, it's about 120 by 80 millimeters of mercury, we'll say this is a normal blood pressure. If the blood pressure has been elevated abnormally by 140 by 90 millimeters of mercury, then we'll say that this is hypertension. We have also studied about the different drugs that can be used in hypertension. Like we have studied about diuretics, we have studied about the drugs used in renin-angiotensin system, we have studied about the drugs that act as sympathiolytics, vasodilators, calcium channel blockers, beta blockers, alpha blockers. We also studied about the different drugs that can be used in emergency of hypertension, mean hypertensive crisis, or in pregnancy, or in case of mild, moderate, and chronic hypertension. We have also gone through the drugs that can be used as antiarrhythmetics, and we have discussed what is arrhythmia and what are the different drugs that can be possibly used in different types of arrhythmias. Today we are going to continue with hypolipidemic drugs, and this is actually the topic that is related to coronary heart disease. And the normal incidence of coronary heart disease is correlated with the altered level of lipoproteins like chylomicrons, low density lipoproteins, very low density lipoproteins, and high density lipoproteins. For this, we may have an understanding that what is actually these lipoproteins are going to do, what are the roles of these lipoproteins, and how we can get benefit by reducing the low density lipoproteins or very low density lipoproteins, what is the role of high density lipoproteins. For this, I'm going to share you on video. I'm going to relate it with the simple terms that we have studied in the physiology, so that we will be able to understand what these lipoproteins are going to do and what is going to happen if there is a deviation from the normal level of these lipoproteins. So let's have a view of the video that I'm going to show you on your screen. Hyperlipidemias are actually commonly known as hypercholesterolemia, mean high levels of the cholesterol in our blood. You can say high levels of lipids in our blood. Lipids are actually of different types that may be commonly said to be of two types. They are considered to be cholesterols and triglycerides. These are the two common types of the lipids that are being present in the body. Body needs cholesterol to function properly, and it makes all the cholesterol from the liver, and liver is going to provide us cholesterol that we are going to utilize in our body. For example, cholesterol is being used for the cell membrane or normal functioning of the cell membrane. Cholesterol is also being used for with the sunlight for the synthesis of vitamin D. Cholesterol is also being used for the synthesis of different hormones, like by use of adrenal glands, or the testicles are also going to use cholesterol to produce hormones. Our liver also uses cholesterol for the synthesis of bile, and this bile is going to digest the fat in our body. Triglyceride is actually being supplied by different types of the food in that we are going to take it for energy. For example, there are different sources of the triglycerides like fatty foods, refined carbs, alcohols, and simple sugars. Our liver have lipids, but these lipids are not able to move in the bloodstream without some adjustment. So liver has to make some adjustments, and these adjustments are like proteins wrapping around these lipids and forming a molecule that is said to be lipoproteins. Lipoproteins now are able to travel through the bloodstream towards the cells and going to provide energy where there is needed. Depending upon which type of lipoproteins, the cholesterol or triglyceride they are said to be bad cholesterol or good cholesterol. For example, these are very low density lipoproteins and they are said to be bad cholesterol as they have enriched cholesterol and triglyceride in them. And this stuffed triglyceride and cholesterol is being carried by these very low density lipoprotein, and they are going to travel to the body by the bloodstream and going to transfer the triglyceride to the cell and provide the energy to the cell. If a liver forms and more different high level of very low density lipoproteins than required for the energy, these very low density lipoproteins are going to store as fat cells. And after losing its triglyceride, these VLDLs become LDLs, which only have a cholesterol in them. And these LDLs travel through the bloodstream and deliver the cholesterol to the cells wherever there is needed. If a body makes too much LDLs, it can deposit in the walls of the blood vessels, causing plaque formation of fatty material in the vessels, and that causes damage to the vessel walls. And they are ultimately going to be deposited anywhere around the vessel wall and going to reduce the lumen of the vessel. And in this way, this deposition of the plaque and or atheroma around the vessel is going to cause reduction in the blood flow. And it usually occurs in different arteries, and if it too occurs in the coronary arteries, the one that are going to supply the heart, due to which the supply to the heart is going to reduce and going to cause decrease in the blood flow to the heart. And if it do occur in the blood vessels that are present like in our neck, our carotid arteries, in this way it is going to cause decrease in the blood flow in our brain. Our blood also have high density lipoproteins. These are those proteins that have a high level of protein in them and a very little amount of triglyceride and cholesterol. And they are said to be good cholesterols because when they are going to travel through the bloodstream, they are going to provide they are going to deprive the triglyceride from the cells and going to store inside them. And they are also going to absorb the fatty tissue, fatty cells from around the vessels and going to reduce the plaque and going to take all those lipids from the areas towards the liver and going to excrete it out of the body. Therefore, they are said to be good cholesterol and they are going to serve good purpose in our body. There are a number of the risk factors that are going to enhance the level or enhance the risk of hypercholesteremia, like cholesterolemia, like genetic issues, or more common are smoking, hypertension, obesity, diabetes, lack of exercise, consumption of a diet that is containing excess saturated fatty acids. They are all the factors that are going to enhance the risk factor for hyperlipidemia. And what we need to do is we have to manage it, as the occurrence of the coronary heart disease is positively associated with high total cholesterol level in our blood and more strongly with the elevated LDL cholesterol in our blood. In contrast to LDL cholesterol, high levels of high density lipoproteins cholesterol have been associated with the decreased risk of heart disease. And reduction of the low density lipoproteins level is the primary goal of the cholesterol lowering therapy that we are going to study today. This is a chart to show you the plasma concentration level of the cholesterol, the low density lipoproteins and high density lipoproteins. Here you can see is this one is the normal level of the total cholesterol in our blood. I'm just going to show on the marker. This one is the normal level. If our cholesterol is going to raise from this level, it is said to be hypercholesterolemia. Similarly, you can see this one is the normal level for the LDL level. This one is the normal level for HDLs. If it is going to be decreased, then it is going to lead towards hyperlipidemias. So we can see hyperlipidemia are the conditions in which the concentration of the cholesterol and triglyceride carrying proteins in the plasma are elevated above the normal level. And when the lipoproteins increases, the development of atherosclerosis is elevated above the normal way. When lipoproteins increases, the development of atherosclerosis is faster and is a risk of factor for myocardial infarction. LDLs are the primary carriers of the cholesterol, while the VLDLs are primary carriers of the triglyceride, as you have seen in the video. Patients with a hyperlipidemias may be given hypolipidemic drugs. They should also be recommended to reduce their body weight in order to reduce the obesity, and low cholesterol diet is also recommended to them. As there are a number of the treatment options for hypercholesterolemia in patients with a moderate hyperlipidemia, lifestyle modification is much more efficient or evident to bring about the changes such as diet, exercise, weight reduction. They are considered to be lifestyle modification that are going to help in case of moderate lipidemias. Hyperlipidemia, and they can lead to modest decrease in the low density lipoproteins and increases the HDL level in the blood. Coming towards the treatment options for hypertriglyceridemia, elevated triglycerols level are independently associated with the increased risk of coronary heart disease. Diet and exercise are also considered to be a primary mode of treating the hypertriglyceridemia. Hypolipidemic drugs. Now we are moving towards the therapy, pharmacological therapy of hyperlipidemic drugs. Hypolipidemic drugs mean there are different drugs that can be used as the drugs that are going to lower the lipid level. Number one is HMG-CoA reductase inhibitors, that includes the lovastatin, simvastatin, and pravastatin. Fibrates include jamfibrezole, clofebrate, and fenofibrate. Bile acid sequestrant, cholestyramine, and cholestyramine are bile acid sequestrant. Antioxidants include probacol. And miscellaneous are nicotinic acid, acetamide, and neomycin. Let's revise the hypolipidemic drug once again. I said each HMG-CoA reductase inhibitors like novastatin, simvastatin, pravastatin, they are HMG-CoA reductase inhibitor. As the heading is going to show you, these are the drugs that can be going to inhibit the enzyme HMG-CoA reductase. Wherever there is a term ACE, it means this is the enzyme. So these drugs, lovastatin, they are going to inhibit this one enzyme, HMG-CoA reductase. Then are fibrates, that includes jamfibrezole, clofebrates, and fenofibrate. Bile acid sequestrants are cholestyramine and cholestyramine. Antioxidants include probacol, miscellaneous nicotinic acid, acetamide, and neomycin. Now we'll discuss each category one by one in details, like statins. Statins are also called the drugs that are going to inhibit the HMG-CoA reductase enzyme. So they are the ones that are going to lower the blood cholesterol level. They are going to work on LDL level. They are going to reduce the total cholesterol level, or mean the total low density lipoprotein level that has been elevated, and they are going to lower it down. So HMG-CoA reductase inhibitors are also said to be statins, and they are going to inhibit an enzyme hydroxymethylglutaridyl CoA enzyme that is a rate controlling enzyme in the biosynthesis of the cholesterol. Like here you can see HMG-CoA is going to be converted into mevalonate by an enzyme HMG-CoA reductase, and we are going to give HMG-CoA reductase enzyme inhibitors that are going to stop the conversion of HMG hydroxymethylglutaridyl CoA to the next step, and in this way it inhibits the synthesis of the cholesterol level. Statins are actually said to be competitive inhibitors of HMG-CoA reductase enzyme that lowers the low density lipoproteins, cholesterol, and triglyceride. And they also meanwhile tries to increase 10% increase of HDL cholesterol. Now the point is how statins work. And I earlier told you they are the drugs that are going to inhibit HMG-CoA reductase that converts HMG to mevalonate. And this way it inhibits the synthesis of cholesterol. Moving towards the pharmacokinetic profile, they are well absorbed, given orally. Simvastatin is a prodrug that is converted to active metabolites. And the adverse effects are gastrointestinal disturbances, headache, insomnia, rashes, insomnia, sleeplessness, angioedema, and they may also cause hepatotoxicity. Although this is not common, but it do occur with these type of statin. The very commonest effect of statin is GIT disturbances, that it do causes nausea, vomiting, and diarrhea. Like another adverse effect is it causes myopathies due to which the coloration of the urine is usually brown, hepatotoxicity, the the other thing important thing is they must not be used in pregnancy and in lactating women. The one more thing, additional point about statin is when we are going to use them, they increases the level of serum transaminase enzyme. This is the enzyme that is usually raised if there is something going wrong in the liver, and as these drugs are going to cause toxicity in the liver due to this effect, there is increased level of serum transaminase level. So patients who are using statin should be watched for the hepatotoxicity. They should be checked either their serum transaminase level is either going to increase. If it is going to increase, it means they are going to be have affected liver. All these statins are also going to cause myopathies and rhabdomyolysis. Rhabdomyolysis is disintegration and dissolution of the muscle, due to which there is going to cause myopathies or muscle aches. The precaution include the concurrent use of the other drugs that may cause myopathies, including fibrates and niacin. They should not be combined together with the statins. Contraindications include pregnancy, lactation, children, and teenagers. Here, their drugs should not be used. Contraindications are the conditions in which you are not going to use the drugs. The next we have are the uses of statins. We know they are being used for lowering the cholesterol level, so we may use them in myocardial infarction, angina, stroke, transient ischemic attack. They are considered to be first-line drugs for hyperlipidemia, both for the familial and secondary causes. The next we have is the fibrate. This is the second class of hypolipidemic drug, and these fibrates are the ones that are going to lower the triglyceride level, and they are going to be used in hypertriglyceridemia. What they are going to do is they are going to lower down the type of the lipid fat, and they are going to reduce the triglyceride level. So the triglyceride are actually the source of energy that we may come from the diet, and if we are going to excessively use such foods that are rich with triglyceride, like fatty foods, refined sugars, and they are going to cause increased level of the triglycerides. If our triglyceride goes beyond the level of 150 milligram per deciliter, then they are going to be cause like imbalance, and if it reaches to about 400 milligram per deciliter, then we say the patient has a hyper level of triglyceridemia. So it may give number of these side effects if not left untreated, and like heart attack, it causes stroke, it causes heart disease. Moving towards the next is the mechanism of action, how they are going to act. Basically, they are also said to be PPA are activators. What they do is they are going to inhibit the synthesis of the triglyceride by breaking these free fatty acid, and by these free fatty acids they are going to break them down, and the liver is not able to combine these free fatty acid and not able to produce the triglyceride. The point is why the liver is not able to do this, because fibrates are going to affect the DNA, and that is going to increase the level of the lipoprotein lipase enzyme, and these lipoprotein lipase enzyme breaks down the chains of free fatty acids, due to which they are not be able to used by the liver and going to be formed by triglycerides. I'm again going to tell what these fibrates are going to do. They act on the DNA. They are going to release lipoprotein lipase. This lipoprotein lipase is going to inhibit these free fatty acids, and these free fatty acids are being broken, due to which the liver is not able to use it, due to which the triglycerides are not able to be formed. And this way they reduces the triglyceride level in our blood. So fibrates are the one that are going to inhibit or reduce the triglyceride level. The commonest side effects of these triglycerides are they causes liver toxicity and muscle pains, along with they causes gallbladder stones and nausea. They should not be combined with statins, because they also causes liver toxicity and muscle pain. The next category we have is third one is bile acid sequestrants. What does this bile acid questions are and what they are going to target? They are going to target the low density lipoproteins and going to lower them by preventing the reuse of bile acid. What is going to happen is the bile is actually synthesized by the liver by the use of cholesterol, and then it is going to be stored in the gallbladder. And after being stored in the gallbladder, whenever there is a required a fatty rich food is going to come in our intestine, this bile acid is going to come and going to break down or dissolve that fatty acids. Now we are going to say that the bile acid sequestrants are going to do some action. What they are going to do, bile acid sequestrants, as the word is in, sequestration means something silence or unable. Normally, for this, you need to revise the normal physiology, and normal physiology is that the gallbladder is having bile acid, and this bile acid is formed by the liver by the utilization of the cholesterol, and the cholesterol is going to synthesize by the liver and going to give you bile. And when we are going to eat some hamburgers or something like that, what is going to happen is the food is going to come in our intestine, and the purple one are the food molecules here you can see, and the yellow one is the bile acid that has been secreted in response to this food, and the red one molecules are bile acid sequestrants that are our drug that we have taken. And normally what these bile acid sequestrants are going to do, before that, just look at the physiology. Normally I said bile acid do come to dissolve these fatty acids, and after dissolving them, the bile acid, 97% of the bile acid is again going back and is going to be stored in the gallbladder, and here it has been able to store and it will be reused for the next time. But this bile acid question are going to do is that whenever the food fat is present, the acid come. Okay, fine. But the bile acid questions are going to bind the bile acid, and by binding this bile acid, they form a complex and take this bile by the bile acid questions out of the body, due to which this bile is not able to store back into the or reused again in the gallbladder. I'm again going to revise. I said normally what happens whenever the food comes, bile acid comes to dissolve it and absorb it. But after absorbing the food or after promoting the absorption, the bile acid is going to back or going to store back to the gallbladder and after performing a section. Fine. But our bile acid questions are going to do is that they are going to bind to the bile, and after binding to the bile, they are forming a complex and making it unable to be stored again and taking it out of the human body. As a result of which, there is not a back flow of the acid towards the gallbladder, and gallbladder become empty. When it becomes empty, it gives the another feedback to the liver that I am empty and I need cholesterol for the storage and for the emergency utilization bile acid, and due to which the liver is now imposed to make new bile by using the cholesterol, and it takes the cholesterol from the blood and other tissues and use that cholesterol and form new bile. And after forming new bile, when we eat the food, it is been taken to the intestine, and if we have taken the bile acid question, we are going to utilize that bile and taking it out of the body. In this way, we are utilizing our cholesterol by promoting the release of the bile from the body out. The next we are going to discuss about the effects that has been seen, as these bile acids and all these fatty foods are not being absorbed, so they are going to be get out of the body, as a result of which the patient usually have fatty type 2. So I said there is a fatty type stool, or there is a decreased absorption of the other drugs has also been observed by the use of these drugs. Constipation do occur, increased level of triglyceride is seen, as this is going to work over the cholesterol only. The next are the details of the bile acids question. I told you what they are going to do. I said they are going to bind to the bile acid in the intestine. Okay. They are going to excrete them. Okay. Bile acids are required for the intestinal absorption of the cholesterol. So the plasma cholesterol and LDL level falls. Although these bile acids questions are unpleasant to taste or take, they may cause gastrointestinal upset, constipation, and piles. The next we have another drug is that is well familiar with the name or well known with the name Zetia or acetamide, and this is very interesting to know about this Zetia. What does it is going to do is Zetia is also named as acetamide. What it do is it lowers the low density lipoproteins by blocking the dietary cholesterol absorption. It is going to absorb the cholesterol that we are going to take in our food, that when we are going to eat burgers or like such things, what is going to happen, it is going to increase the low density lipoprotein level. And if our low density lipoprotein level is raised, it's good better to use the zetia, and the zetia is not going to cause the absorption of that fatty rich food, and this way we are going to get rid of that food and also going to taste the food as well. So this is a detailed mechanism that how this zetia is going to inhibit the absorption. In our intestine, there is an carrier that is named as NPCILI, and the function of this NPCLI is to carry this cholesterol that is present in our food in our body. But zetia is going to inhibit this NPCLI to not perform its action, and this way in the fatty burger or fatty foods are not going to be absorbed and not going to increase the level of the low density lipoproteins in our blood, and it is going to give us nausea, diarrhea, and also going to cause fatigue. So this was all about Zetia, that we said it selectively inhibits the absorption of the cholesterol and the photosterols by enterocytes. It concentrates in the brush borders of the small intestines and interfere with the absorption of the cholesterol by inhibiting the specific transport protein NPCLI, which takes up the cholesterol from the intestine lumen. As a result of the decreased clearance in hepatic cholesterol, leading to increased clearance for the material or food. And this way, the Zetia is going to decrease the plasma LDL level by 15 to 20 degree with a marginal increase in high density lipoproteins. The next category we have is antioxidant. Antioxidants include propofol, and that is a synthetic antioxidant that lowers the plasma cholesterol, LDLs, and HDL levels. It's been used with other hyperlipidemic drugs as they have not high efficacy in action. Nicotinic acid is going to also inhibit the lipolysis and thus increases the lipoprotein lipase activity that results in lowering the triglyceride levels and LDLs and reduces the synthesis of very low density lipoprotein. I hope last one is neomycin. It forms insoluble complexes with the bile acids in the intestine that lowers the cholesterol level. And this is a summarized view of our today's lecture, that which drugs are possibly going to be helpful in reducing the triglyceride level, which are going to target the cholesterol level, and which are going to target the both. Gemfibrozole and other fibrates are considered to be best one to in case of elevated triglyceride, while the lovastatin are considered to be best one in elevated LDL level. And gemfibrozole and lovastatin both are good in case if you want to control both the triglyceride and cholesterol level. And this is another picture to show you summarized view of all these drugs, what they are going to be said. Bile acid binding cisterns are going to increase the bile acid, and they increases the hepatic cholesterol, decreases, and they decrease the hepatic LDL receptors and decreases the plasma LDL. Similarly, statins are going to inhibit the HMG co-reductase enzyme. Acetamide with Zetia is going to decrease the intestinal absorption, and all of them are going to reduce the plasma LDL levels. With this, I'm going to wind up today's session. Inshallah, this will be very interesting for all of you when you're going to hear this video and found all these concepts clear after watching the video that I have added in this start, in order to show you what these very low density lipoproteins, and high density lipoproteins are, and how they are significantly important or not important. And I'm going to post up this video in the Google Classroom. Kindly go through it tomorrow. Inshallah, we will have an lecture interactive session in which we have an oral quiz type activity related to this lecture. So you have to go through this lecture. Allah Hafiz.